Assalamu alaikum students. Today I will be discussing with you an important topic, that is shock. Students, in very simple words, shock is defined as an imbalance between oxygen requirements of the cells and oxygen demands of the cells. It means that there is inadequate oxygen to meet the metabolic requirements of the cell. So we can call it as cellular hypoxia. Cellular hypoxia. This is the main mechanism of shock. Okay, students? Now, there are 4 different varieties of shock. Number 1, cardiogenic shock. Cardiogenic shock means, students, there is an abnormality at the level of the heart. As a result, the heart is not pumping sufficient amount of oxygenated blood to the tissues and other organs of the body. The causes of cardiogenic shock includes MI, that is myocardial infarction. Number 2, valvular defects of the heart. Okay. Number 3, cardiac papillary muscle rupture. Okay, cardiac papillary muscle rupture. CCF, congestive cardiac failure leading to congestive heart failure. Okay, these are the main 4 causes of cardiogenic shock. Now students, we move towards another type of shock, which is obstructive shock. Obstructive shock. Students, in obstructive shock, there is an obstruction in the circulation of the blood. As a result, there is interruption in oxygen supply to the blood to the different cells and tissues. The clinical examples of obstructive shock, most common, pulmonary embolism, there is massive embolus which interrupts the circulation of oxygenated blood to the different vital organs of the body. Okay. Now students, we have 3rd type, hypovolemic shock. Hypovolemic shock. Students, in hypovolemic shock, there is inadequate blood volume. As a result, there is decreased oxygen supply to the vital organs and tissues. Hypovolemic shock, it may be because of acute bleeding, which we call as hemorrhages. Okay. Dehydration. In dehydration, there is volume depletion, and clinical dehydration may be because of vomiting, diarrhea, increased perspiration in hot climates. Okay, these are the causes of dehydration, hypovolemia. Students, in cases of burns, there is also hypovolemia, as because there is increased accumulation of fluid in the interstitium. Now, our fourth variety of shock is distributive shock. Distributive shock. Students, in distributive shock, as the name indicates, there is an abnormality in the distribution of equal amounts of blood. We can say that there is abnormal increased vasodilation. As a result, there is pooling of blood in the peripheral vascular system. Because of this pooling of blood, there is decreased venous blood to the heart. There is decreased venous return to the heart, and as a result, there is insufficient amount of blood present in the ventricles to be ejected. So these were the four different types of shock, or you can say four different etiological factors of circulatory shock. Now students, whatever the type of shock is, there are two main mechanisms. Number one, cellular hypoxia. Cellular hypoxia. This mechanism is common to all types of shocks. Number two, cellular hypoperfusion. Cellular hypoperfusion. And number third and last, cellular dysfunction. That is loss of function. Okay students, these three mechanisms are common to all types of shock. Always keep them in mind. Number one, cellular hypoxia. There is decreased supply of oxygenated blood, which leads to cellular hypoxia. Number two, cellular hypoperfusion. Cells and tissues, they are not adequately supplied with the blood. And number third, cellular dysfunction. As a result of hypoxia and hypoperfusion, there is loss of normal functions at the cellular levels. Okay, now we discuss the mechanism of shock in detail. You can say pathophysiology or mechanism of shock. Students, under normal circumstances, oxygen is required by the cells to carry out their routine metabolic activities. When there is inadequate oxygen supply to the cells, as a result, there is deficiency of ATP required for the cellular metabolism. Means ATP, which is the main source of energy for the cells, it is decreased in conditions of hypoxia. Now what happens? Body mechanism converts from normal oxidation of amino acids, glucose, normal oxidation of glucose, amino acids, fatty acids. This is converted into glycolysis. Okay, the main mechanism is converted into glycolysis. As a result of glycolysis, ATP ions are produced along with pyruvate. Okay, pyruvate plus 2 ATP molecules. These are the end products of glycolysis. Students, under normal circumstances, this pyruvate enters the citric acid cycle. But here we have condition of hypoxia, so pyruvate is converted into lactate and lactic acid accumulation, which is the hallmark of hypoxia. So as a result, there is lactate accumulation or lactic acidosis in the cells. Lactate accumulation. Students, second mechanism is under the conditions of hypoxia, there is depletion of ATP. So sodium potassium pumps, they fail to act efficiently. As a result, there is accumulation of sodium potassium pumps. They fail up, and there is accumulation of sodium and water inside the cells. And this accumulation of sodium ions and water ions, they leads to hydropic cell swelling. The cells, they swell up, and this is the beginning of cellular injury. Okay, students? Another mechanism, there is increased calcium accumulations inside the cells. There is increased calcium ions accumulation inside the cells, and as a result of this accumulation, the calcium ions, they damage the internal organs of the cells. Now students, under the conditions of hypoxia, there is increased production of oxygen free radicals like H2O2 ions, free oxygen ions, and superoxide ions. Students, these oxygen free radicals, they are also a source of energy for the cell. Okay, so these were the smaller review about the mechanism of injury which occurs in the shock. Now students, signs and symptoms of shock. Whatever the type of shock is, the signs and symptoms are cold and clammy skin. Cold and clammy skin. Number 2, decreased level of consciousness. Decreased level of consciousness. Number 3, increased heart rate. Increased heart rate. Number 4, increased respiratory rate. Okay. Number 5, decreased urine output. Decreased urine output. Number 6, constriction of splenic vessels. Constriction of splenic vessels. Students, as a result of this constriction, patient feels nauseated, vomiting, okay, and abdominal pain. These 3 signs and symptoms, nausea, vomiting and abdominal pain, they are because of constriction of splenic vessels. Okay. Now students, there is increased production of aldosterone and cortisol hormones by the adrenal glands. These are the main signs and symptoms which are common to all types of shock. Now students, we discuss compensatory mechanisms. Compensatory mechanisms which takes place in the body to compensate in conditions of shock. There are 2 main compensatory mechanisms. Number 1, which occurs at the kidney level, and number 2, which acts at the baroreceptor levels. Students, when there is hypoxia and hypoperfusion at the cellular level, baroreceptors, they become activated. As a result, there is increased sympathetic stimulation. There is increased sympathetic stimulation. As a result of this sympathetic stimulation, there is increased heart rate, which later on increases the cardiac output. Which increases the cardiac output, and as a result, blood pressure is elevated. Okay, this was the first mechanism occurring at the baroreceptor and sympathetic stimulation level. Now, what about the kidneys? How the kidneys respond? When there is hypoperfusion of the kidneys, there is activation of renin, angiotensin, aldosterone system. There is activation of renin, angiotensin, aldosterone system. As a result of this activation, there is increase in the circulatory volume. There is increase in the circulating volume of blood, and so This increased circulatory volume of blood increases the stroke volume and cardiac output of the heart, thereby trying to compensate the downgoing blood pressure. So this was the compensatory mechanism which automatically comes in action under the conditions of shock. Students, inshallah, in our next lecture, we will discuss individual types of shock one by one. Thank you. Allah Hafiz.